Hello, my name is Brenna Ryan, and I am a second lieutenant in the United States Army and a second-year medical student at Des Moines University. Today, I will be representing the Student Association of Military Osteopathic Physicians and Surgeons in a discussion of understanding post-traumatic stress disorder. What is PTSD? PTSD is a treatable psychiatric disorder that occurs when a person observes, experiences, or learns about a traumatic event. Previously known as shell shock, PTSD is no longer just restricted to service members. In fact, it occurs in 15 million US adults each year. The trauma that can induce PTSD comes in a variety of forms. This includes things like natural disasters, being involved in war and combat, being taken hostage, being a victim of terrorist actions, being a victim of sexual or domestic abuse, and becoming a prisoner of war. The type of trauma can also be acute or chronic. If it is a relatively short duration, then we're going to see acute PTSD. But if someone experiences prolonged amounts of trauma, lots of trauma over a long period of time, repeated exposures, this can eventually develop into a complex form of PTSD that can often have a more severe presentation of symptoms and can sometimes be more challenging, although not impossible, to treat. There are various factors that can predispose someone to be more likely to develop PTSD. Some internal factors include identifying as female, have an attitude of self-blame, and having prior emotional or behavioral challenges. Some external factors that can contribute to this predisposition include encountering childhood adversity, having a prior exposure to trauma either in childhood, adolescence, or adulthood, and most importantly, having a lack of a social support system. PTSD is diagnosed through a series of criteria. First, there must be exposure to a trauma of some sort, either through witnessing a traumatic event, experiencing a traumatic event, or learning about trauma faced by a close friend or family member. Secondly, we must see some sort of intrusion of this trauma into a person's daily life. This can come through the form of dreams, intrusive memories, or even flashbacks. What we also see is a persistent avoidance of anything that can set off these intrusive thoughts. So any situation, sound, person, or experience that might induce more of these traumatic memories to appear. Patients with PTSD often present with alterations in their mood and thinking. With thinking, this can manifest as inability to remember the details of their traumatic event or distorting the details of their traumatic event. With mood, this can come through not enjoying things that a person previously did, not connecting with people as much as they used to, and not being able to experience as many positive emotions. With changes to arousal and reactivity, we see that people can become hypervigilant, can have stronger reactions to surprises, and can even have more overt anger and outbursts. With arousal, we see a lot of sleep disturbance. Any presentation of these symptoms in some conglomeration for greater than 1 month is highly indicative of PTSD. There are two primary treatment methods for PTSD, psychotherapy and pharmacotherapy. Within psychotherapy, there are many approaches, including prolonged exposure, cognitive processing therapy, and eye movement desensitization and reprocessing, to name a few. The goal of these different psychotherapies is ultimately to reduce anxiety, confront the trauma, and reshape the distortions that have occurred as a result of this trauma. With reducing anxiety, we see techniques such as meditation and breathing exercises to help the patient control their thoughts. With confrontation, we place the patient in a scenario where the trauma is reproduced, but in a more therapeutic way. With the presence of a therapist or with other guiding factors, we allow the patient to have more control over the traumatic environment. This ultimately allows them to accomplish the final step of reshaping their distortions. By working with a therapist in this safe environment, it's possible to remove the link that has formed between the traumatic stimulus and the fear that that patient encounters. One such way that this has been done was demonstrated in a small study in 2019, where 20 veterans of various ages and genders were exposed to video games as a form of confrontation treatment. This is just one example of how confrontation can be used. In addition to individualized therapy, we also see success in group therapy with PTSD treatment, as this allows for not only the confrontation of trauma, but also the use of social support systems to show patients that they are not alone in their struggles. Medications used to help treat PTSD include selective serotonin receptor inhibitors, or SSRIs, and prazosin. SSRIs are used to improve mood by leaving the molecule serotonin in a receptor synapse for a longer period of time. And prazosin is an antihypertensive agent which can help reduce the prevalence of nightmares. With proper treatment, PTSD has good outcomes, especially if patients avoid substance abuse, prevent additional trauma within their ability, and maintain good social supports throughout the treatment process. It should also be noted that since PTSD can occur simply through learning about the trauma that others have experienced, family and friends of those with current or prior PTSD should also consider seeking therapy to improve their quality of life. Thank you for joining me today as I discussed post-traumatic stress disorder. If you have concerns about yourself or a loved one, please reach out to a local healthcare provider as soon as possible and continue the discussion with them. Thanks again, and have a wonderful day.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.